The holidays can be stressful, even in normal times, and mental health experts say that the situation is much worse right now, thanks to the coronavirus pandemic, of course. As people continue to forego holiday traditions and miss out on seeing their family, the chances of being hit with stress and depression are much more likely. According to experts, 64% of people with a mental illness report the holidays make their conditions even worse. So joining me now with more on this is forensic psychiatrist and former healthcare policy fellow, Dr. Daniel Bober. Thank you so much for joining us. Doctor, there are a lot of people that not only are they not going to be able to gather with their family, which if they thought the holidays were stressful, at least you had that you would have your family around you. But some people are going to be missing family members forever. There will be no option for future Christmases for them because their family members have succumbed to this virus. It's difficult. What advice can you give people? It's a big, broad question, but how do people prepare for the holidays in light of this additional stress that they're facing?
Well, it's really adjusting to the new normal, the social isolation, economic devastation, the virus itself, which has turned the world upside down. If I had told you a year ago that we would be in this situation where hundreds of thousands of people have died and our lives would totally be disrupted, no one would ever believe it. But I think it's important to try to use the crisis as an opportunity to try to focus on the things that we do have and to have gratitude. If you've lost a loved one and you're going through that, I think try to focus on honoring their memory and not their absence. So it's something that's very challenging, I think, but we all have to try to move forward and make the best of it.
When we talk about things like a depression or anxiety, a lot of times people don't sort of associate that with a mental health issue. They think mental health issues are for other people, and they may not even be aware of the signs and symptoms of these sort of issues. They don't know that maybe when you wake up in the middle of the night and your heart is fluttering, you may actually be dealing with anxiety because they've never dealt with it before, and certainly their friends and family may not. So, tell us what to look out for. What are the signs and the behaviors that may indicate that someone is struggling?
So we want to look at the patterns of people's behavior and any disruption of those patterns. So, for example, people are having a pessimistic outlook about things. Maybe there's changes in their sleep. They're losing weight. They're not paying attention to their hygiene. They're not maybe showing up at work or showing up at school. Of course, with the pandemic, it's different because most things are online right now. These are all signs or symptoms where if you're seeing them in people, they may need professional attention.
I think that what you pointed out about most things are online is a really good, I want to underline that because, at other times there would be some really strong red flags, but it's hard to figure out that someone is removing themselves from their social network at a time when we've all removed ourselves from our social network.
Isolating already, right?
Completely.
So that's the point. If they're isolating, it's much more difficult to know, which is why it's important to check in on people even when you think that they're okay, and to really make an effort to do that.
I want to ask you about coping mechanisms. Sometimes, it's very obvious when people are engaging in a coping mechanism that's not going to be productive. We've been cracking jokes, everyone has about people drinking wine in the middle of the morning or whatever. But, when somebody is sort of leaning on the bottle heavily, there might be a problem. But could there be other coping mechanisms that are red flags that aren't so obvious? One of the things that you listed is like a pessimistic attitude. I just think about, all these people who are online, buried in all these sort of conspiracy theories, or the world is a terrible place. If that could actually be a coping mechanism that we're not recognizing.
Well, absolutely. I think when people feel lonely and isolated, they want to belong to something. They want to commiserate with other people who maybe they feel like are going through the same thing. But I've seen, these types of maladaptive coping mechanisms in my own patients. Maybe if they were drinking a glass of wine at night to go to sleep, now they're drinking a whole bottle. Or maybe they're ordering out takeout all the time and they're eating constantly. So there's all sorts of mechanisms that we use to try to deal with the stress and to try to fill that void.
I got to ask you about kids, because children don't always display the same symptoms particularly when it comes to depression and anxiety, that adults do. What should parents be looking out for?
So because kids don't verbalize their feelings the same way that adults do, it's very important to check in with them and see how they're doing. Very often kids will present with more irritability, more acting out. Maybe they're biting their sibling or they're damaging things in the house. So it's really important to make kids feel safe, secure, and accepted, and let them know that everything is going to be fine and that you're going to be there to support them.
So we've seen some public figures do all sorts of things throughout this pandemic, some following the guidelines to the letter, others flouting the guidelines. We know that President-elect Joe Biden says that he will not be celebrating Christmas the way his family has traditionally celebrated Christmas. How important do you think it is for public figures to sort of set an example, particularly when so many people are struggling?
I think it's very important. And, I think that's real leadership, right? You do what people need and not necessarily what they want. And I think we have to look at it like, are we willing to sacrifice one Christmas to have 20 more Christmases? Because this is literally life and death. So we need to, unfortunately, make some tough decisions that is going to protect us all so that we can ensure our future.
Dr. Daniel Bober, thank you so much. I'm hoping that whoever needs to hear this conversation will hear it from you, and it'll make a difference. Thanks a lot.
Happy holidays. My pleasure.
Same to you. So if you feel that you or anyone you know may be struggling with depression during this time, call 1-800-273-TALK to speak to someone at the National Suicide Prevention Lifeline.